All right, folks, I am real excited today to be speaking to Heather and Tom Najjar. They are the founders and owners of CarePlus Home Health. And Heather and Tom, really excited to be with you today. I had the honor of being at your 30th anniversary celebration. I can't believe that you've been in business for 30 years. Tell us a little bit about the origin of getting uh, Care Plus started.
Well, Steve, thanks for having us. This is an opportunity we are looking forward to. And yeah, 30 years ago, boy, would never have imagined we'd be here today. So the origins are I started Care Plus back in '95, and around the time my dad had gotten sick and was sort of reaching end of life, and had started Care Plus to assist with that, and was able to provide some level of care before he passed on in 2000. And we has since then continued the work of growing and nurturing the business with a focus on quality of care rather than numbers. And that was our focus from day one, to make sure that we're providing good quality care and not just to grow and become, the largest agency around. We wanted to have a good reputation and rely on referrals as our source of business versus just advertising. Um, and we built a good reputation, I'd like to say. So we are in the community, made many partnerships with communities as well. So
Well, speaking of which, when I was at that celebration, I saw a ton of people that I've been working with for decades as well that are um, amazing community builders here in the senior living space, aging life care managers, social workers, what have you. And they all really spoke very highly of your organization and its attention to the clinical needs of older adults. Heather, tell us a little bit about your background and what the philosophy is with Care Plus related to the clinical leadership.
Well, I've been a nurse for 32 years, and I'm doctorally prepared nurse practitioner as well. And our clinical team, our leadership team on the clinical side, are all registered nurses with their bachelors, the two primary clinical leaders with me. And my assistant director of nursing is actually a pastor and has been a nurse for about 20 years. And my other nurse in house is uh, an educator at a local nursing school as well. So we're a pretty strong team clinically, and we provide excellent education opportunities to our caregivers.
Um, One of the opportunities that I recently heard about is that all of your CNAs, I believe all of your CNAs are going to be, if not already, CMT, and CMT is Certified Medical Technician, I believe.
It's a certified medication technician, meaning that they're
Certified
legal.
Medication Technician. Okay, which is an amazing service to your clients in that the CNAs can administer medications, correct?
Exactly. That was a goal for this year. I love helping our caregivers learn new skills. And so it was our goal in January. At the time, our CNAs were about 15% CMT also. And now in July, we have reached about 70%. So my goal is to be 100% by the end of December.
I love it. Um, Okay, now another sort of thing that I'd like to weave in to our conversation today that I think is really special is I've had the opportunity to speak at recently at an independent senior living community that Care Plus has a very deep relationship with. And I was absolutely blown away at your team and how they knew everybody's name in the building. It wasn't just the clients that they're serving. they are woven into the fabric of the community. And I really saw a huge benefit for these independent living residents in this building that doesn't have any healthcare provided, that they can affordably and easily receive support from CarePlus if they need it. Is this something that I went to one building, but I imagine you're doing this throughout the Montgomery County and Maryland region.
Yeah, Steve, we have partnerships with at least, well, several other communities, and each one is actually unique in the way we operate with them because, as you mentioned, this one is an independent living community. We have some that are assisted living, some that are CCRCs, which is a continuing care retirement community. So it's offering different levels of care. But we fill that gap when there's either no care or not enough care. We can fill that gap, and we call that flex care. We can provide services for as little as 30 minutes at a time, up to 24/7 care when someone needs it, and then ramping back down to part-time if need be, because we're in the building. That helps the fact that we have an office there, we have on-site staff that are dedicated to that property, and they provide the care from providing hands-on care to some light housekeeping or other errands. We even provide, incidentally, some transportation services. We have got a fleet of vehicles that we can take people to appointments, shopping, you name it.
I saw that there because I parked right behind one when I was coming in. I think it's absolutely amazing. I mean, this is so many times when I'm talking to families, when I'm talking to providers, these a minimum, is usually 4 hours. And oftentimes families might not have that budget. It's difficult to coordinate consistent care. And what a great service to the residents of the community. And I also hope that families look at it also as a strategy. It's like perhaps mom or dad could move to an independent living community with some support if Care Plus is there. So that's a great reason for folks to reach out to you. Um,
Thanks.
so the I I I I don't want to put you on the spot, but the 30 years in this business, what are some of the feelings you get when you look back at all the people that you've cared for, the staff and the community you've brought together? Um, the, in your wildest dreams 30 years ago, would you have imagined where you are today?
Not really. It didn't give me starting out. Never in my mind thought where'd I be in 15 years, 30 years, let alone 10. You want to starting, you want to make it past that 7-year mark, which is the mark where
Exactly.
most companies either fail or make it. So 30 years later, I'm being, for lack of a better word, in elation feeling where you're like, wow, this is really cool. We've gotten to a point where we're established, respected, and then some. And I feel more like a wise old man than anything else because people are asking questions. Hey, how'd you do this? How'd you do that? So it's nice to offer support. And we've helped other agencies get started. That's not we feel that that we want good players in the industry. It makes us all stronger. And we partner with many other companies. So I don't look at our competitors as competitors, more resources. We refer to each other, rely on each other for services, information, and it's a great community for that. Yeah.
Yeah, and I see you in the community. I know you've been involved with a lot of community activities, especially GROW's grassroots organization for the well-being of seniors. And I've seen the collaboration with all the other or many of the other providers that are out there. And I think that really speaks to the quality of provider that you are, but the quality of providers that you surround yourself with, that there's this collaboration and helping each other. I'm sure there are some folks out there that take a more competitive stance, but you seem to surround yourself with the with folks in a more collaborative space.
Try to. And I think what makes us strong is it's not a secret, but it's the best kept secret in town. It's Heather and the clinical team. in training and keeping our caregivers up to speed on what they need to know and reminding them on how to do certain skills. They work a lot behind the scenes. I get the benefit of being typically in front of the camera and, being able to do rah-rah for the company, but really the strength is the clinical team making sure our caregivers are up to speed on what they need to know and do. So we do the couple of things like skills lab, but I'll let you take it over from there because that's your department.
Right. Well, thank you. I appreciate that. We do an annual skills day. It's 2 days actually. That is mandatory for all of our caregivers, where we do a hands-on demonstration of almost all the skills that we would do. And it's a really good remediation sometimes if folks haven't used certain equipment in quite some time. It's a good way to get back and make sure everybody's on the same page. And we also do the same exercise during our orientation. All of our orientations for new employees are in person and have that kind of return demo aspect to them. So we're always available. And I think I'm really grateful that the clinical team we have enjoys teaching. We enjoy helping. If a caregiver is integral, they can learn anything, and we will back them up with it. So we will deploy at any time. We never want our caregivers to feel ill prepared. So we're really strong in that area, and it makes me very proud to work with them.
Yeah, and I love that, because while companionship and supervision is an aspect to hiring a company like CarePlus, you want the people that are there, because the reason we're hiring people for companionship is because we have healthcare changes, and you want to know that those companions are at the highest level of training and know how to address our needs as things change. That's wonderful. Now, have you had many caregivers? Is there How many years has the longest caregiver been with you?
Oh,
I think the longest is
20,
15, 20.
20,
Yeah.
20, 20,
Holy
25 years.
cow.
Yep. Rugi's been with us for that long, and another one retired recently, so she was also on our rolls for about the same period of time.
That
Not common, but we do have a few who have been with us for quite some time.
And I think
that
another benefit to the business side and clinical working so well together is we also identify stars out in the field. Our CNAs, who are the best of the best, we sometimes actually bring them into the office. So our staff in the office, other than 3 people, are all CNAs and CMTs as well. So they are able to deploy at any time, and they understand what the caregivers are going through.
Wow. Man, this is great to get a little bit of the inside behind how you've created such a successful organization in the community. Um, is there I is there anything that we haven't talked about today that you'd like to share about Care Plus, whether it be the past, client stories, or the future, that the vision that you have for Care Plus in the future?
Um, one point of clarity, this is not anything major, but just it often comes up. It's about the name, CarePlus Home Health. It's a name. We are a home care company. We're licensed as an RSA, or Residential Service Agency, level 3, which is the highest level, providing skilled level of care. But we're not a home health agency per se. Home health refers to like a Medicare certified agency providing skilled care. We do provide skilled care, but it's skilled private duty care. So we are as a private duty agency, just for clarity, because again, the name is CarePlus Home Health. We do home care though, and that's what to add to that. But going into the future, yeah, I'll let you take that on because you've got some sites.
I think my thought of the day is gratitude. We've come a long way, but we've also surrounded ourselves with excellent people. And I think moving on into the future, we had alluded to this at the 30th anniversary. We are starting a foundation that will be primarily educational funds to help our caregivers who want to further their education. So that's not all ironed out yet, but that's something I'm really looking forward to in the future.
I love it. I love the fact that you're giving back, and we really need to provide as much support to the people that are caring for our loved ones as we possibly can. I love the focus on training and a career path for the caregivers that are working for you. It's a wonderful mission. Um, well, Tom and Heather, this has been an amazing discussion. I am in awe of what you've created, and I know it's not easy to reach this point, but I'm real excited to see your plans implemented in the future. And hey, maybe 30 years from now, we'll all still be talking about Care Plus.
Steve, thank you.
Thank
Thanks for the
you.
opportunity. It was great talking to you and able to share some cool things we're doing here at CarePlus. And mission's not over yet. We're going to continue for quite some time more. Maybe another 30 years, who knows?
Yeah, I love it.
Absolutely.
Okay,
Thank you, Steve.
Thanks.
you bet. Thank you.